Hi everyone, the topic I chose is how lack of interdepartmental communication affects everyday patients and can lead to patient harm. Now, it's very important for all medical professionals to have good communication when it comes to patients and patient safety. Patient safety should be the number one goal, and quality care should be known as a necessity. Now, poor communication is one of the leading causes of patient harm. It can lead to medical errors, prolonging of patient treatment, injury, and even death. There was a study in the 1990s that found that 44,000 to 98,000 patient deaths occurred annually due to poor communication in American hospitals alone. That same study found that poor communication was the leading cause of preventable deaths in hospitals. The Joint Commission on Accreditation of Healthcare Organizations also found that poor communication was the main cause of serious injury or death from 1995 to 2003. Now, there are various contributing factors that can lead to poor communication and potentially patient harm. First is the communication between nurses and doctors. There's a known hospital hierarchy, and we are taught to not question the doctor and their decisions. A lot of times that can cause fear and intimidation and lead to nurses being afraid to speak up and question if they feel something is wrong. The National Council of State Boards of Nursing reported that nurses stated that communication issues with physicians were one of the two highly contributing factors to patient care errors. Now, another contributing factor is the communication between doctors and other doctors, whether it's doctors within the same facility or primary care physicians and doctors they referred their patients to. This can sometimes lead to increased patient wait times. Say if there's a confusing referral or primary care physicians are not clear on why they are ordering such exams, or it's unclear what the diagnosis is. It's every doctor's job to question things like this, and when they are not questioned, sometimes they can lead to complications in the future. Sometimes a wrong test could potentially be ordered, and if it's administered, this can potentially harm the patient. Another contributing factor are shift changes in all departments. For example, day shift and night shifts with nurses taking care of inpatients. A lot of things can change throughout the day, and it's everyone's job when changing in shift and caring for patients to notify that next shift any changes in patients' care, their history, things that they can and cannot do. Patients who are in the hospital for days or months at a time deal with multiple departments throughout their stay. We are all responsible for patient care and treatment, even if we are not a nurse or a doctor. They are in our hands at one point in time of their treatment, and it is our job to all communicate properly and efficiently to potentially help the patient. Now, how this is related and affects to radiology. A lot of times patients get sent down for x-rays, and if orders are not clear, it's our job to call the doctor for clarification. Sometimes there can be the wrong order. It's our job to make sure we understand patients' history to make sure that their history corresponds with the order that is placed for them. It's our job to question again, and we don't want to use any unnecessary radiation on patients if we don't have to. A potential solution is a standardized format called the SBAR. SBAR stands for Situation, Background, Assessment, and Recommendation. Again, this is a standardized format. It can help medical facilities all throughout all departments. It can be a situation briefing guide for doctors. It can be a sense of communication for providers and all medical professionals throughout a facility. It can help with organizing patient charts. It would require participation from all departments within a medical facility, such as x-ray. It would be our job to make sure that we are updating patient charts whenever they get x-rays, and same thing for all other departments. Overall, this could help organization and less confusion with patient care and potentially lead to less medical errors and less patient harm. Now, the takeaway from all this is that communication is key, and it requires participation from all medical professionals in all departments. And coming up with a Solutions such as the SBAR standardized format could decrease overall medical errors within medical facilities and all over the country. Every facility should be finding ways to improve their communication skills within their facility. This is something that is always going to remain important throughout healthcare. Thank you.